within shoulders, we tend to have two different age groups. We've got the young age group where they have more instability type problems. You've sort of got the middle age group who tend to tear their rotator cuff, and then you've got the older age group who tend to develop arthritis in a shoulder, same as you can get hip or knee arthritis. We can look at all of those three groups separately, but if you have had, for example, instability in your shoulder and you've damaged the shoulder when you're younger, that can lead to arthritis when you're older. If you've had a rotator cuff tear which hasn't healed properly and the ball has started to ride out of the shoulder, that can lead to arthritis as well. Or you can simply have either osteo or rheumatoid arthritis in your shoulder, which just develops over time. The more heavy lifting and carrying you've done, the more likely you are to end up with arthritis. Now, within shoulder arthritis, there's now two subgroups as well. There's a subgroup where your rotator cuff is intact, and those people can have what's called a primary shoulder replacement, where the ball and socket are put back the same way they were in their normal anatomy. Or if the person has torn their rotator cuff, then they have to have a different operation. Why is that? Well, the ball and socket are held in place by the muscles, the same as what our current shoulders are. If those muscles are torn, the shoulder will dislocate. So a reverse shoulder replacement actually switches the ball and socket around and relies on the big outside muscle, the deltoid, as well as the shape of the prosthesis to hold it in place and then to move the shoulder. And so the reverse shoulder replacement has been a real game changer for the older patients. Going back to a primary shoulder replacement, when you do the operation, you open the rotator cuff and you repair the rotator cuff. And that takes 6 full months to heal. So the patient's in a sling for 6 weeks after their operation. They start moving it at 6 weeks, and at 3 months we start to strengthen. A reverse shoulder replacement, because it doesn't rely on the muscles of the shoulder, the next day after the operation, the patient is able to use their arm immediately. They can eat their food, wash their face. They wear a sling for about a month just to rest the shoulder and let it heal. And within 2 to 3 months, they've got virtually unrestricted use of their shoulder. And in the older patient who's in their 80s or 90s, not having to wear the sling for that period of time and not having to restrict their activities is a wonderful thing, because 6 months when you're 80 years old is a big deal, and you want to be able to give the person back their independence very quickly.